Hey, it's Chris Beyer.
Chris Bowling.
Good morning, Chris. We've got a great guest this morning in focus.
Sure
Kimberly
do.
from Community Healthcare is Chief Human Resources Officer. Kimberly, if you want to talk a little bit about who you are and what put you into a role in HR and what you currently do today.
Sure. Well, thanks for having me, guys.
Absolutely.
Pleasure.
Yeah, my pleasure. So I serve as the Chief Human Resource Officer for Community Healthcare. I have spent most of my professional life at CHC. Just celebrated my 20th anniversary at the end of last year. So it's been a while. Graduated from University of Iowa. My degrees were in communications and psychology. And I've been certified in HR since 2007. And honestly, I did not have a master plan about being in healthcare or HR. That wasn't part of my grand plan.
Right.
But at this point, I look back, I can't imagine it any other way, honestly.
Yeah. I think that's so often for many people is you start with degrees that get you somewhere, and then you just start to evolve into what becomes your lifelong career.
So when you look at the growth, how many employees did you have in the beginning compared to today?
Yeah, I think when I started, we had maybe 130, 140 employees.
Okay.
And today we're closer to 375. We're creeping up on that 400 mark.
That's amazing.
You're providing healthcare services throughout the Metro Quad City market as a qualified healthcare center. And how do you differ from a hospital system or from just that private clinic that exists, and where do you fit within the market?
Sure. So we provide a variety of services. I think people are really surprised when they hear about all of the things CHC does have to offer. So we're in the Quad Cities. We've got 9 clinics, and then we also serve Muscatine and Clinton. And we have everything from pediatrics to adults, OB. We have pharmacy, lab services. We have a homeless outreach program, behavioral health, medical, dental. We have WIC services, so women, infants, and children. We've been doing some new things in the last couple of years, so express care, school-based health care. Lots of new exciting things that came with COVID that I couldn't have predicted, but things like telehealth, and we added 3 mobile units to our team so that we can go out into the community. So yeah, lots of changes in the last year, but it's been pretty exciting, pretty well received.
Wow.
And you're getting a lot of I guess, funds and funding from the federal government to provide these services. And with that, I'm sure that brings a lot of challenge just to make sure that you're meeting those expectations and going through that. Do you play a lot of part in that from your role in HR about making sure that you're staying, in that compliance side, or again, doesn't matter really for employees, you just know that somebody's taking care of that?
Yeah, I would say the big thing, for CHC, what we do is offer sliding fee discounts. So patients can get our services if they are uninsured or maybe underinsured. And so that is one thing that makes us kind of different than other places. But I think the misconception is that you have to be uninsured to get services here. And that's not true. We're actually here to see everyone. Everybody can use our services.
Oh, that's great. And I think just sharing that message as well and trying to get that out in the community is an important thing. Mm-hmm. So what type of employee comes to work for community healthcare? When you think about that, who is a good fit for you, and why do they stay with the organization?
Yeah, that's a good question. So I feel like our HR team, the colleagues that I work with that do recruiting, and the managers that are part of the recruiting process, they really have focused on trying to find people who are interested in doing meaningful work. So really making a difference in your community. Yes. And if we do a great job with the hiring, then I think it really sets us up for success. So really having somebody who is tied to that mission, who wants to help other people as part of their daily profession. I think that in the Quad Cities, we're pretty fortunate because we have so many different educational programs, from our community colleges to universities to tech programs. And so that produces a lot of the kinds of folks that we're looking for. So people who are medical assistants or dental assistants, nursing, people who are skilled at billing and coding. And so we are definitely fortunate to be here in the Quad Cities because we do have all of those programs. And we've tried to work really closely with them. So trying to get into the schools and let people know about an option in working in a community health center.
Right.
I, for one, 20 years ago, had never heard of an FQHC. And so just kind of stumbled into it. And now, I mean, I just feel so grateful that I get to be part of this community that is, doing good.
Yeah. So what's the best way somebody can find you and can see what job opportunities currently exist in this tight employment market?
That is true. It is tight right now, but we have our CHC website, so that's a great place to see what we have available, and we use Indeed.
Okay.
We'll be at the career fairs and that kind of thing too, and I think it's interesting. Just if I look at the availability of positions we have right now, about half of them are new positions. So we're really trying to set ourselves up for growth and adding new services, being able to reach more patients in the coming years. So lots of new options for people.
That's exciting. Excellent.
So with your clinics and the footprint that you serve, do you expand any further from there, or do you just expand services to the community? Because I can't imagine that you have maxed out capacity for who you need to serve. I mean, there's got to be a need that's growing just in your geographic area already.
Yeah, I think that's a good point. We still have lots of opportunities here. And so, one of the things that we focus on is really ensuring access for our patients. And so, like, we're adding an express care in our Moline clinic. We have one soon to open in Davenport, so that it really makes it easy for patients to get services. That was one of the benefits of introducing telehealth during COVID, is that if you were a person who maybe had some transportation issues, you could still go see your doctor in the comfort of your own home. So that worked out really well.
I think access to care is something that we're all realizing. You're in healthcare, we're working so much with health plans, and it's that same challenge of how does an employee get access to the care when they need it in the right order and navigate that. That's never been harder, probably coming out of COVID. And it's good to see you expanding that.
Right.
Chris, you've got our last question of the day. I know you like this one.
Yeah, and it's funny because Chris and I just recorded something that what do you do when things don't go as planned? So my question is there a quote? Is there a philosophy? What helps you through those tough days?
Yeah, things never go as planned, right?
It's true.
So yeah, you got to be flexible. But I think the key, the things that have worked for me have been just like surround yourself with good people, right? So I always tell folks when they're joining CHC, we don't expect you to be the expert at everything because we've got a lot going on. So if you know how to get your resources, that seems to work the best. The other thing I would say, just when it comes to actually hiring folks, I've had really good luck when I've taken a chance. And so maybe somebody doesn't have all of the qualifications that you would want to see on a resume, but if they have the right attitude and the right compassion for patients and, the teamwork, all of those intangibles, we can train you on the rest. And so we've had some huge success kind of growing our own. So I would recommend that.
I love it. Thank you.
Well said. I think those are two good takeaways for sure. Well, thank you, Kimberly. We appreciate you joining us in Focus this morning. Great to have you.
Thank you.
Yeah, thanks for having me.
Thanks.